ممكن couple of minutes وبعدين نبدأ.
Yeah, Firoa, she's trying to join us.
Okay.
Oh, she's here.
Okay.
Hello everybody. How are you? Hello دكتور نادر.
لا رؤى، كيفك؟ تمام الحمد لله، كلنا بخير. كيفك انت وكيف الحال؟
كويسين. دخلت بالباس كود القديم عشان كده ما كنت قاعدة تجوين.
لا معلش، it's okay. معنا وائل برضه. الابلكيشن ماشي كيف رؤى؟
ما الحمد لله، بس أخذ زمن وهنا مع التايم ديفرنس كون قاعدة لحد 5 صباحا، لكن قدرت ألحق الديدلاين الحمد لله.
كويس الحمد لله، ربنا يوفقكم إن شاء الله.
إن شاء الله يا رب. توفيق للباقيين كلكم.
آمين إن شاء الله. هلو وائل، السلام.
السلام عليكم دكتور نادر.
عليكم السلام ورحمة، كيفك؟ تمام؟
الحمد لله، الله يخليك.
الحمد لله. كيف الابلكيشن بتاعك؟
والله تمام الحمد لله. تمام. من يوم الأربع.
كويس.
إن شاء الله good luck for everyone here.
إن شاء الله بالتوفيق لكم.
interviews إن شاء الله.
إن شاء الله. Okay. I think we can start now. So welcome everyone and thank you for joining. So just feel free to join, jump in with any tips or any notes or any suggestion for the group. Today we're gonna discuss interview skills, right? Well,
yes.
Yeah. So who's ready? We can just start and then we can rotate, inshallah.
Ready.
Yes, okay. Go ahead.
Okay. Yeah, so I'd like to talk about what should we do before the interview. As we know, successful interview require a considerable amount of preparation. So we need to research about the program before we start, and to know what we wear, what to say, and how to conduct ourselves, and what to do after interview. So as we all know that interview is a critical factor in ranking applicants. So it's great to know the goal of interview. So if you already get an interview, that means the program wants you, and like you already made the determinations. So then the next step will be to assess if, like, the program would like to assess if you are a good fit or not. And we could also see if the program is a good fit for us or not. So the program wants to know more about your personality and to learn more about non-cognitive factor about you, like your communication skills and interpersonal skills. Cognitive skills is good for having a successful resident, but non-cognitive skills, what the program wants to test in you. Like the programs want someone who had an emotional intelligence and who responds to, like, who can control his emotion and to see how you respond to others' emotions. So it's always good to search about the program before you go and to prepare for thoughtful questions. You can learn about the program history and program mission, philosophy, area of excellence, and key faculty members. And like you can also check the latest program news in their website to see what they are proud of and what they made recently. And it's also good to check and learn about the person who will interview you, who will be interviewing you. I heard that last year here in the University of South Dakota, someone had his first interview question was, he had been asked, what do you know about the interviewer? So it's always good to check and to know his name. And for us, it's good to know how to pronounce their name. For me, I know sometimes that is hard. So it's also good to know the area of interest between you and the faculty member who will interview you. So you can have something to talk about, and maybe you would be able to make a connection. One more thing is we all don't know what we will be asked in the interview, but it's good to prepare at least for the standard questions, like tell me more about yourself, your strengths and weakness. Those are basic things, and we can have control on. Sometimes some interviews have behavioral questions, so it's just you can understand the goal of those questions and to know that your answer will reflect your personality and how you handle things. So just be cautious while you answer any one of those, even if you don't pass through this question or it is answered before. And there is another thing for yes or no questions. Always elaborate. Like if they ask you if you whether you are interested in pursuing a fellowship in the future or no, just don't say yes. You can maybe talk more about your interest, or even if you don't have a specific specialties that you'd like to go, you can just say, yes, I would like to go into fellowship in the future, but I will see after the residency and the rotation what I will like to go for. Few more tips that we can know. We always have to control the interview, because you don't want to be always just answering. You can just make it like a conversation that you can ask the interviewer too. And like, don't just be the one who answer, and always have a case ready to present. So they may ask you about a stressful time or a memorable patient. And also always prepare for interview and have a mock interview before that. As I said last time, the Department of Labor, it's a government office here in the United States. They do free interview training, so we could check on that too. And always remember, you could be asked about anything you mention in your CV or personal statement. So we have to be prepared and to go through that many times before going to the interview. Yeah, that's all what I have. And that's about the before interview preparation.
Excellent. Thank you so much, Ryan. That's really great. You summarized very excellent tips, and I agree with you. These are very important ones. Thank you for sharing. Whoever ready next, please join.
All right,
Roa has a question, I think, and before Dalia. She is raising her hand.
No,
So, Roa, do you have a question or?
no, I just want to add few tips, but if
Okay.
Dalia have questions, she can.
Oh, no,
Right.
I don't have a question. Of course,
Okay.
add it.
Okay. Thank you, Rayan. I think you mentioned a lot of important tips. First of all, I think when we get an interview, as Rayan mentioned, this means they are interested They read the CV in and out, the personal statement and everything. And what they want to know is that is this candidate is going to be a good fit to the program or not. So mainly they're going to test the personality. Is he or she a kind person, outgoing, collaborative, good team player? These are the things that they want to test during the interview. So when we have an interview, we need to think what to do before the interview, during the interview, and after the interview. Before the interview, I think we should enter to the program website and try to know who is going to be the interviewer, and try to read about like his interest, his CV, is he is doing a lot of researches, is there is anything that is common with the candidate and the interviewer. So this could be something to talk about during the interview. This is one thing. Second thing, we want to know if there is any specific kind of questions that this program like to ask usually. And this thing is easy to know from the seniors, from the resident in the program. If you have anyone inside, he can tell you kind of questions they usually ask. Some programs ask behavioral questions, communication skills questions. They ask questions that test your leadership. So the idea is that when they ask you, like for example, tell me like, what is your leadership skill, or what is your communication skills, or any kind of these questions, you need to answer in a form of story. Like, I remember during internship, I have like a difficult colleague, anything that you have to form it in a story. So this can reflect your real personality. Instead of saying I'm a good team player, I can manage my time properly. So it's good to mention it in a form of story. Last thing you have to do before the interview is to read your CV in and out, because everything in the CV you could be asked about, whether research experience, teaching experiences, clinical experience, even your hobbies or interests. This could be something to talk about or to be asked about during the interview. And the last thing you have to do before the interview is to practice. So it's important to practice with seniors or people who are not your friends, so they can judge you, because your friend will already know you and they know what you mean. So it's better to practice with someone you don't have any relation with. These are the main things that you can do before the interview. During the interview itself, as we all know, this season is going to be virtual. So I think the important thing is to set up the light, to smile, to be relaxed, and try to be yourself. As Ryan mentioned, when they ask a question, don't answer very short answers. Try to elaborate more. Try to be flexible. Like if they ask you about what is your goals, and you are putting in mind you want to do like a fellowship, and you know that they have this fellowship or they don't, you need to be flexible and show them that you are open to all the options. And then lastly, after the interview, you can send a thank you email to the program director and the coordinator. And it's very useful to mention something that happened in the interview, like if there is specific topic or specific talk you had with the interviewer or the coordinator, you can mention this in the email, so they can remember you when they rank their candidates. So I think that's all what I have. Thank you, everybody.
Thank you so much, Trudeau. These are also great tips, and thank you for sharing. And these are important points. So, Dalia, if you are ready.
Yeah, sure.
Sure.
I will basically repeat myself, but I will elaborate more about the setting. The setting is really important. I would think with this virtual meeting, they would put points on it, since like we're saving a lot, to be honest. Like we don't have to go there and fly to the interview. So the background, it shouldn't be like the effect on the Zoom meeting. It have to be like a solid background and really nice. Like that will show us that we are really professional. Other than that, everyone say that, but be ourselves. You have to be yourself. It's all about they want to know who you are. For the interview itself, of course, we have to practice like so many times. Like we can't, everyone say that, but it's really important. It's just like the CS exam. So we have to practice literally every day. The letter of interest, I've heard about it that a lot of people say that letter of interest like sometimes irritate the PDs or the coordinators. So I don't know. I can't talk about it more, but I don't think so. It's a good idea. For sure, the thank you thing, the thank you email after the interview would be really important. It will show that you're really appreciative. During the interview, since it's going to be virtual again. If we are sitting on a chair that like we can rotate to the right and left, you know, like we have to like sit up straight with not slouching or stuff like this. You have to just look. It's going to be hard looking at the camera or looking at the screen itself. However, we can just figure it out, like looking sometimes at the camera and sometimes look at the face of the interviewer. So I think it's going to be fine. If you want like the program really bad, like one of the program that send us an invitation, it's better to schedule it late. Since like, of course, for the first interview, it's going to be like some we are going to have some mistakes in the first interviews for sure. So if you want like the program really good, really bad, like some program, just schedule it late. Another thing is, yeah, be professional. Like show that like you talk with your hand. Don't be like a robot. Like you have smiling, of course. From time to time when appropriate. Of course, you don't have to smile like for no reason. I'm not going to say not to smile for no reason. As I said, I'm just saying that like just a gentle smile. That's it. So I think that's pretty much it. Yeah.
Sounds good. Thank you so much again, Dalia. That's really great and important tips. And anyone else wants to share, please jump in. Khalid.
Assalamu alaikum, everyone. I think Ryan و Dalia, they said it all. Again, أنا برضو بتكلم about the point that Dalia mentioned, the setting for the interview. Inshallah, those who are lucky and get an interview, they need to set their environment very well for the meeting or for the interview. And I send a very nice video. It tells you about all the technical kits and where to sit away from the room or the background. And I send it in the WhatsApp group. I hope if you can get a chance and go check it. I think it will make your setting very good, and it will make you even more confident, and you will be just, as Dalia said, yourself and answer the questions and know your CV very well and prepare to answer some clinical questions, maybe myocardial infarction management or some electrolyte imbalance. In addition to interesting case or a true person that you inspired by or affected your life, or any turning point in your life. This is, and also I have some materials concerning the interview itself, the questions, and people answer to these questions, and then you can personalize your answers according to these questions. Thank you.
Thank you so much, Khalid. These are also great tips, and thank you for sharing. I really appreciate that, and hopefully it will help all of us. Anyone else wants to add or highlight some of the things that were mentioned? Please jump in as a while.
Hello, everyone.
Yes.
I will add a lot to what the already fellows said. So it's just like you have to know basic thing. Like you have to read your CV very good in and out. They're gonna ask about the CV. I had an interview last year, and I can share some of the questions that I've been asked on the interviews. So what they are looking for, they like your commitment to your specialty. They're definitely gonna ask this question: why this like a specific specialty, and your understanding of the specialty itself. You have to be very authentic with this answer. You have to be come up with a very like good answer for this question. Like then they're gonna ask about why the program. You have to know the program. You have to prepare the questions to ask. Like some programs, they have very detailed like information on their website. You can still find like 2 or 3 questions to ask. You should prepare them. And they also gonna look for your motivation or your enthusiasm. You have to convince them that you want to do this residency. They're gonna test your work ethic, your reliability, your maturity, your interpersonal skills through the behavioral questions. So last time they asked me why do you want to be a doctor? Why medicine? Like, and sometimes they ask about the situation. How do you resolve conflict? This is kind of behavioral questions. So they also gonna test your leadership ability, your ability to think critically through this question, behavioral questions, your ability to listen, to answer difficult questions. I don't know. I'm not sure if they're gonna ask about the score or the letters. The letters, they're gonna ask about the letters. They asked me about the letter of recommendation. You have to know your letter of recommendation author. So you have to explain where did you work with him and how long did you work with him. And it should be matching the CV. So you don't want to say something different than your CV, definitely. So what I also wanted to add, this new kind of interview selection thing, a Casper test. I just received it yesterday from a program, and I would like the fellows and you, Dr. Nader, to discuss it in this session, please. So, thank you.
Yeah, I've heard about this Casper test. Why?
Yes.
Only 3 programs for internal medicine ask. So 2 programs say it's mandatory to take this test, and it's a 90-minute test. And the other say that it's preferable if you do it. So according to to those 3 programs, I guess there's a lot of videos has been sent on the groups about this test, I guess. So I think it's going to be really helpful. It's better to just be done with it, because I think there's a deadline. I think October 29th, according to the program again. So I think that's all I know about this Casper test.
All right, thank you, Dalia. I think you're mute, Dr. Nader.
Sorry. Anything? Thanks for adding all this great information, Wael and Dalia. Wael, do you have more information as well?
No, that's it.
That's it. About the test or the information you just mentioned. Is this something new? I think it's new for me at least.
It is new, yeah. It is new. I haven't seen it before. It's brand new. Like even there's not a lot of programs are doing it. Just 3 or 4 programs.
Mm-hmm.
Yes,
Yeah,
I think in. Go ahead, Dalia.
Sorry.
Dalia, go ahead.
Okay. All right. So yeah, the 3 programs are University of Connecticut, I think Parkview in New York, and the other one is Hamilton, University of Hamilton. I'm not sure where it's at. So what is it about? It's about behavior, like just exactly what Weil said. It is just behavior questions, simulation. They're going to show a video. And they will ask, I think, 3 questions after the video. You have to answer them in only 5 minutes. You have to type it. And the whole exam is 90 minutes. I think the simulation test would be, the cases would be 12 or 13, something like that. I'm not very sure. So yes, in 5 minutes, you have to answer 3 questions. Like, what are you going to do? What if you are in this situation? Like exactly what are you going to do in that? Like just to know the interpersonal skills, the leadership, and all those behavior questions. I think it's a really good thing. Of course, like the programs would know more about the applicant, but it's really stressful since we are waiting for the
results.
Yes, exactly. The results will be sent to the programs, and there is no absolute right or wrong there. It just will show how skilled we are. And that's it, I think.
And how much the cost? Or
I think it's free, if I'm not mistaken.
You identify the programs that your results.
Yes. Yes. So you send the program, like there's options for the only 3 programs for internal medicine. I'm not sure about the others. You just send it to the programs. I guess it's one time. You do it one time, and you send it to. If you do 2 of them, and you have invitation from, or actually they asked for this Casper test, I think it's going to be the same. I'm not sure, to be honest.
Sure.
Of course, you're not going to do it twice. So I think it's one time, and you're going to send it to the programs.
And the limit is 3.
I'm sorry.
The limit of the programs.
Yeah.
That you
for internal medicine, yes.
For internal medicine.
And for family medicine, I think Hamilton only.
Only.
Yeah. That's it.
That's a good thing. I didn't know about that. That's someone sent a chat. That's okay. So I think it's a good idea to explore this more for those who did not take it, and anything can help. I think you should consider. So great. Anyone else wants to add some? I know Lubaba in the airport, and I think she's the one. She said she is mute. You want to add something? Or someone else wants to add?
I have a question.
Oh, Roa, go ahead.
Yeah. A few of the fellows mentioned that sometimes the programs ask clinical questions. I want to know if anyone have an idea, or you, Dr. Nadir, how often these kind of questions being asked during the interview, and what kind of the clinical question and they ask, and what they want to know from your answer.
So if anyone wants to answer that, and I will comment after.
Yes. They asked me this question in my last during my last interview, and this program is specifically from the start. They just asked me, "We read your CV and your application, and we are not going to ask you any psychometric questions. Just tell us about yourself as a person." And just I started to talk for 3 minutes. And then they thanked me, and immediately we started to talk about clinical cases. One of them, I remember, like a case of hyponatremia, severe hyponatremia. I think they told me that his serum sodium was 114, and what he would do. For this is a story, or I can. Do we have a time? Like I can say
sure, yes.
the whole case. Okay.
Please.
Yeah, they said 21 years old, running a marathon. They brought him by the ambulance to the ED, and how he will approach this patient. This is the first question, and I said I will. I answer. I said I will do the. I will take brief history and quick assessment to triage the patients, and then I will do blood sugar, serum electrolyte, basic metabolic panel, and other lab tests. And of course, and I will give him IV fluids because they say he was dehydrated. I will give him IV fluid at normal saline, and after that, they told me we find his serum sodium was 114. What is your next step? And I said I will give him hypertonic saline, and yeah, they said excellent. And you come again after 6 hours. They find his serum sodium. I don't remember exactly, but I think they said 120, 119. I'm not exactly sure. What is your next step? For me, from that experience, I think they need me to know where is my limit. I answered the second question immediately because I just went to up to date and I read like whole hyponatremia, and I made sure that all my answers were accurate. But I think one of the things also they wanted to know, as you asked, like what's behind, to know my limit, like as a resident or to the level of my training. This is one of the things that I recognize. I thought maybe if I answer, I will contact my attending or my fellows or whoever, because they asked me, you as a resident in the ED. Yeah. And I didn't mention this part. Yeah, and after this, then we talk about a case, I think, of heart failure, but it was a side effect.
Sorry, did you mention what? Sorry for interruption.
Yeah, yeah, I did him the things that I recognized during the conversation or after the interview. I sense that they wanted to know if I know my limit or no, and I didn't mention to them that I should consult my fellow or my attending or other specialties. The second case was a case of heart failure and side effect from a medication.
Do you remember it, Khalid?
I don't remember it, honestly. No, I don't remember the details of the second one.
Okay.
But it is easy to answer. Like it's not that difficult or complicated. I remember I answered them. But what I recognize or what I notice that they want you to, I think maybe if you work in a team to ask other people to help you while you're managing the patient, not just to take the case by yourself as I did during my interview. Yeah.
Thank you.
That's a great tip. Thank you.
Yeah, that's very helpful, Khalid. That's excellent. Thanks for sharing.
I have a question. If anyone knows the answer for this one, the question of tell me about yourself is really broad. At the same time, you have only 2 to 3 minutes. We don't want to bore the interviewer. So, what things we should mention it on the how? Tell me about yourself. Am I going to repeat myself, telling things in my personal statement and CV, or what exactly in 2 to 3 minutes?
If anyone wants to answer, and then we can comment. Yes, please go ahead.
Hi, Dalia. I have been struggling with this question specifically, so I can give you some few tips from what I know from the seniors and the interview where I practice with. I think in Sudan, we tend to answer this question like, tell me about yourself. My name is Ruai Samaddin, and they already know who you are. So this is the first thing that you should never mention. Don't start with my name is Kida, because they already know who you are. You can start and don't answer the question by talking about your CV. There is a template or example of answering this kind of question. You can start with, I will talk about myself, okay? Like, hello, I came from Sudan. No, like I was born and raised in Sudan in 1991. I came from a big family. I have like 3 brothers, 4 sisters. All of them like lawyers, engineers. I'm the only doctor. Uh, um, you can mention something about your med school, like you were a good and hard worker and you work hard till you earn a spot in a prestigious university in your home country. And then you can talk a little bit about your interests or hobbies. Like you can say personally or outside of this, I love cooking very much. I cook to my family, for my friends. What I'm trying to say is try to answer this question like really an answer that reflects who you are, not your name, not your CV, your experience. These things they already know. This is what I have been told.
All right, thank you. Thank you so much.
Excellent. Thank you for sharing, Roan.
It's
That's
Dr.
really
Nadia
good.
can add
Oh,
something.
sure. Yeah. So for this question, as you said, they want to know how you explain yourself. They don't really, most of the stuff might be in your CV or the personal statement, but they know how you interact with them, how you display yourself, what else you can show them or highlight about yourself. As you mentioned, you can mention in the CV, you like cooking. That's very limited answer in the CV. But if you mention that I cook for my family and I invite my friends and they like it, and or if you sometimes they you can say I like to explore more about other food types like Indian food or whatever, just to explore what you mentioned in your CV a little bit more to show that you have extra interest in some area. But the basic thing, yes, as you said, Roa, tell them about yourself, about your family, about what's important in your life, what's your goal in your life, something personal that they want to share, they want you to share with them. Yeah, I just a brief thing would be great. Yes, that's a great question, Dalia. And regarding the other question about the cases, as Khalid said, I would say it hit a miss. Some physician will ask you the question and focus on the clinical aspect, but as he said, they want you to show them how you critically think about the case and how you try to manage from the knowledge that you have. I'm sure they know, all of you, you pass step 1 and step 2, so you have the knowledge. It's just the processing. And as Khalid said, how you want to ask or seek help from your colleague, your supervisors attending, or from other subspecialties. So you want to show them that you work in a team. You are not going to be the hero from the start to the end. So you want to answer, elaborate in your answer as you can. If they ask you about your own case, if you prepare a case, that's a good one for you, then you want to study that case well. So if they offer you the chance to mention the case, then you want to practice how you want to present the case in a way that's interesting for them. And again, it's just a matter of practice. You practice, 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 and then hopefully it will be like a second at your fingertips, something like that.
Present what case? I'm sorry.
If they ask you, here's the option. You might not be asked about the case. So that's one option. So they are interested in you answering other type of questions. Some attending might be interested in a case where they ask you what your interesting case that you faced during your training in school or outside. So you can prepare a case to mention to them, any clinical case that you think is interesting, and try to practice how you present this case and what's the lesson that you learn from this case. The third option or the third possibility is they will corner you, like Khalid said. They want to give you the case and then they want to see how you react, how you interact with them, how you show the critical thinking about the case, and how you, if you have the limit where you show them that you need to ask another colleague, another like senior of your team, or the attending, or the other subspecialty for help with the case. So they don't want you to be mentioning the whole step from A to Z by yourself. At one point, you will need to work in a team or ask others. So these are the three possibility for clinical case, if I'm making it clear for you guys.
Yes, definitely. Thank you.
Thank you, Kanal. I remember one point I also want to mention.
Sure.
Also, I have an Egyptian friend, and he went to the interview, and I don't know what is the story behind electrolyte disturbances.
Mm-hmm.
They asked him specifically about hypokalemia, and he said after that question, he felt that he lost this interview because he wasn't able to answer and he wasn't prepared for such a question, and he ended up match as that same program. They rank him and they selected him. So even if you ask about there's a clinical case and you feel that you did well, just try to be yourself as much as possible and do to the best of your knowledge, and try to conduct the rest of the interview as it is. This is a point I wanted to mention.
Sure. Thank you for sharing this, Khalid. Yeah. So sometimes the same way they look at you, they want to get, it's like a point score, 1, 2, 3. So it's only one aspect of the interview, the case and the case presentation. So if they spend with you 10 minutes, maybe in 2 minutes it will be about the case, but you have still 8 other minutes to discuss, and they will score you on these other 8 minutes. So by all means, feel at ease when you answer the question, even if it's a difficult question. Maybe the intent is to see how you interact or how you react to this. It's not they want to fail you or put you in a corner. But again, as Khalid said, think positive and just do your best, and they are interested in you as long as they already offered you the interview. So be your best, and that's what I want to share. Thank you. Any other questions or addition? Yes,
I
please,
just want
Wael,
to add,
go
if
ahead.
possible, to
Yes.
from my understanding, when they ask about a case, either if they want you to tell them about a case, or if they present a case for you. So what they want to know is that 6, like, or 5, I'm not sure, core clinical competencies. So your patient care, you should bear in mind, like, while answering this kind of question, these core competencies: patient care, medical knowledge, practice-based learning and improvement, interpersonal and communication skills, and your professionalism and your system-based practice. So you should just bear in mind, you should read about these core competencies while answering the case, or like explaining the case for them. You should really focus on this. I don't think they are really interested in you treating the case effectively and successfully, other than just using these competencies. I think this is going to be their checklist, maybe. Not sure.
I totally agree with you, Wael. So they might have an idea about the case, or they have the checkpoint or checklist of the case if they want to ask about the case. But again, this is part of the interview. There are other part of the interview. So even if you think you didn't do well in this part, you still have other part of the interview you can do well. But be prepared in any way to, if they ask you questions, answer them. And if they offer you the option to share a case, then be prepared to share a good case. And as Wael mentioned, maybe you can touch on a different aspect of the things that they want you to show. Thanks for sharing, Wael. Anyone else?
I have one comment.
Oh, yes, please.
Regarding what Wael mentioned, a lot of programs ask about US experience, especially this is an important thing in the CV. They like calculate how months you have practiced in the US. So they ask what are the differences between practicing in your home country and US. So in the answer, you have to mention what Wael said, the core competencies, the patient care, whether you communicate with the patients. We can all read about them and know how to answer this kind of question. A second important thing, like we all know that we work in a bad environment back in home country, so don't try to reflect this as a negative or bad thing. Like you can say, despite of the limited resources we have, we still work in a very hard environment, and these things like I have learned to be blah blah blah. So you have to reflect it as a good thing, if you know what I mean. This is one thing. um, Another question a majority of program directors or the interviewer ask at the end, like they ask you whether you have a question to them, if there is anything specifically you want to ask about. So we need to be prepared to this kind of question. You can ask the interviewer a specific question about the program, like if the percentage of resident who like go to be primary care physicians versus hospitalists. You can ask about their volunteer activities, how they participate in the community, or what is their participation to the underserved area. So we can prepare a list of questions specifically to each program. Thank you.
That's great, Roa. Yeah. So if between you guys in the WhatsApp group, or if you are using the app, maybe you can come up with a list of most common questions that you can prepare to ask, and you can during your review of the program, you can modify these questions, or maybe you can come up with other questions about a specific program, and that also goes along with when you do your research about the interviewer who will see you. You want to look at their CV if there is any their interest, and see if you can come up with some questions for them on a personal level. Like I'm not sure how that will display, but if you can come up with some questions for them personally, that might be also a good thing. Thank you. Thanks, Roa, for sharing. Anything else that we
Yeah,
can
regarding what
yes.
regarding what Roa said, they're gonna ask definitely about most of the fellows here. So they put on their CV this research experience. So I'm expecting that more than 80 or 90% of the program, if any of you got invited, they're gonna ask about it. So what's the proper answer to say to them about this experience?
So my goal from the fellowship, one is to prepare you, but the main goal, I think, that you can share with the program during the interview is that you can answer any question with, this is a good question, thank you for that. So you can say, number one, the US is one of the countries that we find the number of older population is increasing. The complicated cases are increasing. Most older patients will have more than 1 or 3 chronic conditions. The number of physicians, although is increasing, but the demand is huge, and it will be huge in the future. So wherever specialty you will go, you will find some geriatric population. So at least we need to prepare to manage this group of patients and to study them, about them, and see what's the best thing to manage them in the future. The other thing is you want to improve your skill about the research area, because in medical school they offer you the clinical side of things, but there is a limited time to spend in the actual research unless you finish medical school and then you spend 1 or more years in research only. So this fellowship will offer you the opportunity to obtain some tools and sharpen some of the skills that you learned during medical school and improve on them while you are doing your own research project. So you can summarize what I said, but you can add your own project. So you can say, I know there is an increased number of older adults. I know there is a shortage of physician. I know we're gonna face a lot of older population with whatever. And then you can say, this fellowship offered me the opportunity to work in this area. I learned so much in how to use SPSS, how to analyze data, how to think critically about patient, or how to present interesting cases during meetings or conferences, something that in that sense. So, and you can flip and tell them about your own project. So you can say, I learned this or I did this, and you can sometimes during the interview you can answer a question and then you can add something in your answer of interest so that you can lead them. So to ask you about a certain area. Let's say during the interview, they did not ask you about this fellowship and you are already ready to give information about the fellowship or the project that you are in. So you can mention it in any of the answer to them in a way that you seek their interest to ask you about it, if make myself clear.
Yeah, thank you so much. That was very
This is
helpful.
very helpful. Thank you.
Sure. Yeah, you're welcome. That's a good question. While any other questions or any addition or these are very good tips. Thank you all for sharing.
I have a question about the risk factor of COVID in elderly patient. The IRP approved it, right?
Yes, so there are a couple of steps. Step one is the IRB from the MSU. They approved it. And then the next step is Sparrow Hospital, where the patients are. So Sparrow, they have their own IRB. So we filled the forms, but they ask us to complete some answers, specific questions. So I send them this back. So still we are waiting for the approval from the IRB from Sparrow Hospital. After they approve that, then the next step will be to contact the IT team so that they can prepare the data for us. Hopefully it's not going to take long. I think it's just a query. The computer will generate the data for us. There are some students from MSU here. They did some study in the emergency room, collecting some data, so they helped them. So I don't expect it's gonna take long. So we're gonna wait and see. So the first step is to get the approval from the IRB from Sparrow, and the coming step is to talk to the IT at Sparrow to generate the data. Hopefully, if we get the data, then we can just separate ourselves into groups, and each one will work on their aspect, and hopefully we can come up with some analysis and some conclusion, and you'll be ready to present.
Okay, another question. What if till the hope the IRP will approve it, but what if it didn't approve it, like until someone get an interview? Should we still talk about the project?
Sure, yeah, you can talk about it, and in fact, you can, if you just tell them about what's your idea about the product, what's the title for you, like I'm interested in finding more about COVID, and let's say you are interested in nephrology, so you can say COVID in older adults and the effect on renal function or risk factor with as far as renal conditions or heart problems. So this will be your topic of interest. And then you tell them, so we are working, I collected some literature review in this area. We know it's not that like the COVID is a new thing. So I found some articles, but in the process, we applied for IRB to MSU, we got the approval, and the next step, whatever step I just told you. So at least you will show them that you are working on something and you know what you are doing as far as the steps. Does that make sense, Dalia?
It does. Thank you.
You're welcome. Good question, though. Any other questions or comments or tips? So I want just to share some of the things that from my personal experience in the past. So I was at your show in the past. I had some interviews. Some went okay, some didn't go well. So one tip I want you to focus or to, if you want to do, prepare before, as you said, after and during the interview, but take notes. Notes are important. After the interview, you want to see what questions they ask you, write them down, and see were your answers to this question. See if there is any room for improvement. So you might have similar question in your next interview. So at least you will have a better chance to improve your answers. And then you can also share the questions with the other fellows so that they can give you feedback if you need to, if they have something. So at least all of us will be prepared in certain area. This also will help you when you are done with the interview to write something about the interview that is common between you and the interviewer. So I think Ra mentioned, or someone, when you write a thank you letter or email to the program director, you can mention specific things. And if you write to the same interviewer, you want to raise something, some point you discuss with them, and you think it's interesting for you. So at least they will remember you when they are doing the evaluation, or when they are doing the discussion, because sometimes I don't know how it works in residency, but at least in my geriatric fellow, when we are doing the clinical geriatric interviews, we have a list of questions. You score from 1 to 5 about how the interviewer went. Did they meet, let's say, the CV requirement or whatever. And then during the interview, what did they display as far as communication skills? Do they look real, like they show real interest in the field? Something like that. So there are 5 or 6 questions. You mark them and you put a score, total score, and then we can compare the candidate according to the score. So I assume it will be the same for the interview for you guys. It's gonna be like a score based, and then they will discuss these scores between the program director and the group of the interviewees. And they will say, yeah, this candidate showed this. So if you wrote an email, you may increase your chance that they remember you, because it's gonna be online. It's gonna be a brief, maybe 10, 15 minutes, half an hour with you. You want them to remember some things about you. So in the email, you can highlight some of this. So you need to take some notes after the interview or during the interview, so that you can remember how you can email them. The other part is this time of the year. Usually when they have the interview, they have a tour where they will take you to the hospital or the clinics or the facilities that they usually you were working. So maybe this is a good area where you want to ask them about the facilities. So is it one hospital? Is it more than one hospital? How is the clinic and patient load? Something like that. And also you can ask them, if I want to get more information from the residents. So in the years before, usually you have some residents, second year or third year, tag along with you, and you have opportunity to ask questions about the residency program. So during the interview, you can ask them about, can we get a list of some of the residents, current second year or third year, so that we can ask a specific question for them. That might be also an opportunity that you want to seek. Aside from that, I think all the tips you shared today are very important. And I thank you all for sharing, and hope the rest who didn't join today, they can share in the WhatsApp group or in the app their tips, if they have additional tips, if they have any comments or addition as well. Thank you all.
Thank you.
I have
You're
a
welcome.
question.
Sure.
Why you mentioned something about the lore author, LOR author. So what are the things that they're going to ask about the lore, the author?
Well, they ask, where did you work with him? How do you know this person? Stuff like that. So
What if I didn't work with them? For instance, like a lot, like sometimes we get a lore from someone that we know, you know, like most
you,
of.
you can mention that you did not work with him, but you know him. They can ask, how do you know him? Like, it's, if you did not work with him, just mention you did not work with him, but I know him personally. I think that might hurt, but
Yeah, I
if,
guess.
yeah, so
Mm-hmm.
it's not like a guarantee questions. Maybe they're not gonna ask it, but the last time they asked me, how do you know this person, and who, why, like, especially if he's not mentioning in the letter. Some authors, they mention in the letters where did they work with you, and is and explain it very well. So they might not ask this question if he already mentioned where did you work with him and how he know you, or how she knows you. They might not ask it.
Yeah, as most of lore authors ask about the CV, and then accordingly they tell that we know the person as they did this and this. You know what I'm saying, right?
Yeah.
Last thing I want to mention before I forgot, my interview was through Skype last time, and I want you to just be ready before the time. They call me 15 minutes before the time that we should have the interview. You hear me?
Yes.
Oh
Yeah, we
yes.
can hear you.
Yes,
So
yeah,
it's
yeah.
15 minutes
Yeah.
before, that's very early.
Yeah, they said
Like
the interview
what time
is
exactly?
yeah, they said that my interview was supposed to be 11:30, and they called
11.
me
Oh,
by
okay.
11:30 a.m. and they called me by 11:15. Luckily, I was ready. I don't have anything, but just
Maybe
to
they just came in earlier.
to
They
not
want to
be
wait for you.
surprised. Yeah.
Khalid, I have a question. Last
Okay.
year they did virtual interviews, or was it a special case?
Sorry.
Last year,
Uh-huh.
last
It
season, the
was
match
virtual.
did.
It
A
was
lot of
virtual. Yeah,
programs did virtual interviews, or just yours?
no, mine. But most of them, yeah, were
In person,
in
right?
person. Yes.
Yeah, some
Okay.
programs have been doing the virtual interview for a while now. It's not just this year.
Okay.
But the
Not
virtual
because of the
interview.
COVID.
Yeah. Yeah. Even
Okay.
it is very close to me, the hospital, and I offered to join. They said no, we can just do it virtually because it is just a 4 hours drive for me. Like
I thought
yeah.
that like yes, last year I've heard about those virtual interview in the past, but I thought like there are two interviews. So there is a first virtual interview, and then according to it, they will call. Was that the same thing, or was it just one interview?
No, it was just one
One.
interview, and they interviewed two Sudanese people, me and another guy, and I'm glad that he matched at that program.
Best of luck this time, inshallah.
Yeah, inshallah, to all of us.
Khalid, regarding your experience with virtual interviews and with in-person interviews, what type of the interviews you felt more comfortable at?
You feel more comfortable and I think more convincing the in-person interview because you have some connection with the people and they can see clearly your non-verbal language or the non-verbal cues of your conversation, the emotional
Yeah.
part. Yeah, but in the virtual one, this non-verbal cues during communication, it might be lost. So also this point, I think we have to be very careful about about talking about ourselves or answering these questions, to be fully engaged and to focus on the camera while we speak without.
By the way, what is the proper thing to focus on, the camera or the person who is interviewing us?
No, if you focus on the camera, you will be focusing on everybody. I think he or she can see you.
Okay.
I think you can just, in my opinion, at some point you have to look at the person's face. It's kind of weird just looking at the camera.
Yeah.
I think it's
That's
just
why
sometimes, yeah, you can just sometimes look at the camera and then look at them. I don't think so. It's going to be really hard. So if it's like 5 seconds looking at it and then looking at their face, their expression, then again look at the camera. Like with practicing, I think you'll be better.
You should make it like in person, like 50% eye contact, like you said, right?
Yeah.
I I just watched some videos on YouTube and the videos that I sent to you on WhatsApp, like how to conduct this kind of interviews. I'm not sure, but they said just focus on the camera and speak, and this give everyone in the room a sense that you are looking at them directly. And maybe also we can try to do our own practice. We can focus on the camera and we can try like different ways, and we will see how's eye contact or engagement.
I
Thank
think
you.
when you are talking, it's better to look at the camera. So they feel like you are looking inside their eyes or you are, yeah, contacting them. But when they are talking, I think it's okay to just take a look on the screen and see.
Okay.
Agree with
Um,
you. Yeah, go ahead, Roa.
Thank you.
So I want to share a tip. Maybe you can use it. So I'm gonna share the screen with you guys. Let's say share. So this is the screen. It comes if there are more it depends on what software you're gonna use, or they can use Google Meet or Skype or Zoom. So if you have it's better to have your camera in the middle of the monitor or down, so that you can at least see what your eyes will be. You are not looking from one side to another. The other question is you can move this so that you can put it near the camera, and if there is a speaking person, it will be on the top. So you will not move your eyes far away. It's the camera is here, the person is here. So even if you are looking at the patient and the person, your eyes might be connected to the camera. The other tip is if they are talking, look at them. If you are talking, look at the camera. So it's kind of, you are talking into their eyes. Sometimes you might want to see their reaction, but at least try to, if you are talking, to look in their eyes on the camera.
And if they are talking, I should look at
Then
them
if they are talking, then you look at them and see what's their expression, and you can nod and smile or do whatever you want to do as interaction with them. But if their photo or their image are near the camera, it's not going to be a big of a difference for them to say you are looking at their image or at the camera. But if they are here in your screen and then you are looking down, and then when you go up and down, this make a little bit of confusion. Why are you looking down? Something like that. So if you have the ability to make the screen where the image of the person who is talking up and then your camera is up, the distance for you to change, it's just your gaze will go between the image and the camera, not as far. And always try to just when you are talking, talk to the camera. It doesn't make sense when you are talking to the camera. It makes more sense to look at the image, but you have to train your brain to figure this out. That's the person inside the camera you are looking at their eyes there.
Okay.
It's just practice. Try to
Yeah, it's
practice
all
it.
about practice. Yes, you're right.
Yeah.
Thank you, Dr.
You're welcome.
Dr.
Yeah.
Nadir, I have
Yes.
one
Hello.
question.
Yes, go ahead.
Yeah, sorry. Is that like, any program expect us to present a case or something like that? Like you are sharing our screen?
I don't think they will be interested in sharing your screen, but some of the program might be interested in hearing your interesting case, either from your perspective, as they discuss that they cannot ask you, tell us about an interesting case. So it's open question for you. So it's better if you prepare a case that's an interesting and you learn something from that case. Excuse me, that case, and you can share that case with them. So if you practice that case, it will be easier for you to present that case. The other possibility is that they may present the case for you and they want you to manage the case. And as Khalid mentioned, they don't want you to answer as if you are, you want to manage as if you are really managing the patient, but also they want to see how, if you want to ask for help as far as your supervisor or attending or another physician subspecialty, you want to seek help as well. Because in real life, when you are in the hospital, you will see the patient, you will admit the patient, for instance, and then you will discuss the case with the attending, and then they will agree with you, or they will add some things, maybe ask you a question about other stuff that you didn't think about. So you want to mention that I'm gonna discuss the case with my attending, and we're gonna change the plan accordingly. And if there is a possibility to ask for subspecialty, then you can mention that. So they want you to think out of the box. It's not the case and you, but what else you want to seek help from. Does that answer your question, Sumi?
Yeah, I mean, what I understood is like probably that makes sense. It's kind of like they expect us kind of test our like kind of clinical knowledge or something, but not exactly like how the case goes. So they expect us to answer back like how the case is going. That's what I was thinking, because last time when I went for interview, there was a didactic lecture for the residents. So we also attended there, and while the lecture was going on, I guess their expectation was like, if we as the interview candidate, if any of us knows the answer, like they're talking about COPD and asthma management. So I think they appreciate if we answer something. So I was thinking like how all this, and some of the program, sometimes they ask like clinical questions, like how you manage diabetic ketoacidosis, or like a case presentation like a diabetic ketoacidosis, and like after these what we are supposed to do, something like that. So I mean, yeah, that makes sense now. Probably they will share the screen and they will ask a couple of questions. Yeah. Thank you.
You're welcome. Thank you. Thanks for sharing. And again, okay, go ahead, Khalid.
Yeah, sorry. Yeah, I just want to remind you, I will send, there is a preparatory interview and some technical part of how to set your environment done by, prepared by MGH, and it is going to be presented on the October 29th, and I will share with you to join them through Zoom. I think it will be also very helpful.
Sounds good. Thank you. I really appreciate Khalid. That's great. So again, remember this time of the year, I mean, the interviews will be virtual. So I think it's good to mention to the interviewer that during this period of time, it's a unique situation where in the past, we have the opportunity to do, as you said, you can attend some of their didactics, or you can attend some of the tours. You see the hospital, you see the residents in action. So this time might be different. So you just think about it and think if you want to share something along this line with the interviewer. Good. Any other
Yeah,
comment? Yes.
still have a question about the case presentation.
Mm-hmm.
What do they exactly mean by case presentation? Is it like case presentation research, or just a case that you found in the observership or anything, and then they were like, okay, talk about it?
Yes, it's about the case that you found during your internship, observership, externship, whatever you name it, or maybe during your medical school, or they want the clinical aspect of the case. So you will say, yeah, I remember this vividly. It's an interesting case, 35-year-old female who presented with abdominal pain, whatever, blah, blah, blah. And we did this, and the interesting part is we worked on this, whatever. So you want to just share some of the clinical aspect of the case, as well as what you learned from that case as far as um, leadership or seeking other help or teamwork or you name it. It's just whatever you think an interesting clinical case in your life you want to share. And I think it might be a good idea if you guys present to each other some cases so that you can practice this during your interview practices in the WhatsApp group, or if you want to make teams and then discuss or work together.
Okay, thank you.
Okay.
Yeah, Dalia, I want to add in regards to that something like when I went for family medicine last time, family medicine interview. So one of the faculty, I think he grew up here, and then he told me like as a physician in your whole life, describe me a case where you feel yourself challenged, and how did you manage yourself that challenging situation as a physician? What was your role? So I think his expectation was like presenting a challenging case that was pretty different from the other interview. So that's why I want to share with you guys. I was not totally prepared for that, but however, somehow I managed. And he also mentioned that you can, while you are doing internship back home, probably your country is, as far as I know, your country is very endemic for tuberculosis and malaria. So if you can tell me regards to something about that, because my medical school is here, and I literally did not travel any country other than US. So I want to hear from you that with limited resource back home and TB endemic area, how did you manage yourself as a challenging case? So I presented a case which is like a tubercular meningitis, which I have seen during my internship. But I think I could do better if I prepared for that. But I was not prepared really for that type of question. So I just gave you an example, like someone can ask you something like that.
All right, thank you.
Mhm.
And again, during the interview, remember it's as if it's items. They want to check these items. One of the item is the case presentation, but the other items, they want to see how you interact with them, how you use the technology, how you, and it's different checkpoint. So one of the checkpoint is the case. So if you are well prepared for that, that will give you a better chance. If they ask you something that you were not prepared for out of the blue, just try your best. And as Weil mentioned, they may be looking at certain criteria or specific area. If you can touch base on these areas, then you will be good. Good. Excellent. Thank you for sharing, Sumi.
Yeah, I think Dr. Nadir is right. They have a checkbox, and they are talking. They asked. I mean, my 3 interviews, they all of them asked about some question about APIC actually. I mean EMR, because one of the faculty asked me, let's say there is a situation where you suddenly enter into a room, patient room, and before you, your one of the your peers, I mean your another resident physician see that patient, and as soon as you enter the room, you see that the computer is open and all the patient charts is open and you have a nurse with you. So what you are, I mean, what's the first thing you are supposed to do? Are you going to tell your attending that your previous resident physician keep it open and left the room, or you're going to close the chart? Like, what is your opinion about it? So that was a like EMR question, I guess. And yeah, as I think I work, so I kind of know the work ethics a little bit. So, and HIPAA and all that. So those questions, at least my 3 interviews, they ask like this a little bit about EMR question, I guess.
Excellent. Thank you for sharing. Yeah. So they want you to know about the HIPAA as well and the regulation. If you have some tips on this or you want to read about this, that would be also good just to be prepared. Thank you for sharing. Anything else you want to add, Khalid or others?
Hi everybody. I hope that you will have a successful season this year. And thank you very much, Dr. Nadir, for giving us from your time. I just want to it's all about this season. It's all about the virtual and how it's going to change the interview the interview outcome. I guess it puts more emphasis on the words, on our words and the type of words we are choosing for the interview, since we are losing the very important part, which is an in-person and the non-verbal communication. So I just want to remind you guys, we need to make use of our video chat during Zoom so we can practice. I think most of us now, we are not sharing our videos. It will be a great idea next time if we start doing that. I know all of us, we need to practice and practice and practice again. The interview, it's all about practicing, I guess. You have to prepare for all kind of questions, and most common of them is the question of tell me about yourself. It's the most common question. There is a million ways of answering that question, but I guess it's supposed to be not to be boring. I guess you're gonna have to tell the highlights, as you have mentioned. It's highlights about yourself. Remember, the interviewer have interviewing like maybe 30 or 40 people. They have listened to everybody, and they are human beings. They will be bored. So just try to connect them. And we are losing the important factor of in-person. So just grabbing their attention by only your words, it will be like another challenge. So not to be elaborate on your personal details, like, and so just highlight the most, like the most valuable asset, I can say, in your tell me about yourself. And don't forget your personal qualities, and mention that you're like everybody said, your hobbies. How do you what do you find it most fun? Like, tell about yourself is not about CV, or it's just a highlight. And relax and try to practice. And I guess we should practice more asking specific questions, if you agree with me. Like, for the next meeting, let's say we're gonna tackle tell me about yourself question, or tell me what's your weaknesses, what's your strength, and we're gonna give everybody like 10 minutes video to talk about that. If you agree with me, we can give a feedback for each other, and honest feedback. If you think that this person is going too much for details, if you think that honestly I was losing my attention when I was listening to you, that would be very helpful, I guess, to make use of each other. And Dr. Nader, of course, you're gonna be like our mentor during this. And one more thing, the behavioral question now, and I got the Casper test. One of the programs sent me that. It's computer. It stands for computer-based sampling personal characteristic or something like that. It's mostly about how would you deal with the work environment. It's more if you have a conflict with a colleague, if someone was that type of questions. A lot of programs, they are incorporating that in their interviews. So we can practice that one day, and also be ready with just be ready with any type of case that you want. And I want just to answer Dalia about the letter of recommendation. The letter of recommendation can be a personal aspect, but it will not be as strong as the ones that comes from your department chair or from head department or someone you worked with. It will not be as, but it's totally fine that you didn't work with that person who wrote the interview, or you just know him. I know it will not be as strong, but bear in mind, you have to look at the letter, what he wrote about you. If he wrote that you worked with him, just stick with that.
Got it. Thank you.
Okay. Good luck, everybody.
Good. Thank you so much, Azza. These are really important tips, and thank you for sharing. Good. Other aspects of the questions that you want to ask them, maybe it's a good idea if you want to, if they have some time for you to ask about their personal experience during COVID. They may ask you, so you want to be prepared about your own personal experience, since if you are in the US in March or April when things change significantly. But maybe you can ask them, how did it go for you guys in your program during this pandemic? How is the virtual aspect? What did you do in your clinics? And those sort of question about their own experience during COVID. So maybe you can use some of the time to seek their own experiences as well, or anything else you want to know about them on a personal level. Regarding the program, if you want to search about their board passing for the residents in the past, how they did, and if they offer some review courses, or they offer some compensation for attending some review courses. Also, what their plans as improving the program, like there are some talk about burnout and things about the quality of life of the residents, what they are doing for the residents. You can ask certain question in this area if you have time, and if you didn't find answers during search about the program. So there are many things that you can ask. Remember, you are ranking their program as well. So you want to make sure this is a good fit for you. I know it sounds, for all of us, we want just to get in there, any program at this time, at this point. But from their aspect, they want to make sure you want to rank them on top. So if you ask certain questions indicating that you are interested in their program, so they can answer that, and then they will feel okay about you that you're gonna rank them, then you will be at ease and they will rank you better. If I'm making sense, sometimes I think I talk too long, but does it make sense to you guys?
Yes, yes, it does. Thank you.
You're welcome, Talia. Good. Any other questions or any other comments or tips that we didn't share?
I just would like to say we might need also to read more about the body language and to know how can we express our confidence and our personality from our body language, as there is the interviews will be virtual. So I think that's the only way to communicate.
Sure. Thank you for sharing this point, and I think you raised a good point. Sometimes every one of us can find some YouTube video or some article or somewhere they can get some information. So it's a good idea to share between you guys in WhatsApp. But if you want to share through the app, that would be also an option so that we can keep this for future fellows down the road. And hopefully you can use the application again and again and let us know if there's any way of improving that way of communication. Regarding Az's suggestion, I think we can divide ourselves into the teams, the 4 teams. I think it might be a good idea if I think in each team there are 4 people. If you can talk between you, the 4, and you can select the time that works for you, even if it's only between 2 persons, and then the other 2, they can select their own time. Let's say Azza and Khalid in one team. So they can talk together and say, hey, how about tomorrow? Are you free? Let's say tomorrow at 2 o'clock, both of you free. Then maybe Khalid, you pretend you are attending the interviewer, and Azza, you want to practice. It's a brief, maybe 10 minutes or answering the questions and see how you do and get feedback from Khalid. And if you have still some time, maybe Khalid, you will be the resident and Azza will be the interviewer, and switch the role and see if you can give him feedback. The other 2 members in the team, maybe they can work on Monday if it's available for them, and then see if they can give feedback for each other. And then you can switch maybe Khalid and the other person, and then Azza and the 4th person can pick up another day for them to work on. So by the time we come next week, at least each one of you practice at least 2 times or 3 times within the team. I think we can do it together. In the meantime, if you have other residents or other people attending during this time that are free or they want to give you practice, I know some group, they want to help. So if you can reach out and see if they have availability, then you may want to do some practice with them, like 5-10 minutes, 15 minutes, see if they can give you feedback, or at least you have the chance to practice answering all the questions we mentioned. So if you want to do that, that might be an option for you guys in Teams. And then when we come next Saturday, we can talk about your experience, what went okay, what tips you find more in addition to what we have today. If there is anything that you find during your practice, maybe I did this, I supposed to do this, I can improve on this, something that you can share with the other team, other fellows. Sometimes it's easier to talk about things, written things, you can just mention them, but when it's real time, you want to practice this thing, you will realize that, oh, I didn't know about this, or I didn't know how to do this way. So perhaps next Saturday, we can touch again on your feedback to each other. If we have time, maybe we can divide and switch teams. Maybe we can distribute and then we can break into small rooms. Then you can practice during that maybe next Saturday if you want to, unless you want to discuss something else or you want to present or do anything else. What do you think, guys?
Good
I
idea.
have
That's a good idea.
suggestion.
It's like we should do this. That's my opinion.
Uh, yeah, I have a suggestion. I don't know if you guys would like to do that or not, but what do you think about like to have a meeting, all of us together, like all groups, and to first see what everyone think about answering the interview questions, and like if anyone had anything wrong, we can correct him. And I mean, when the four groups meet at the same time, I think that would be more helpful. And then we can divide after that, at least one meeting for all of us, and then we can divide again into four groups. And yeah, Dr. Nadir like doesn't have to attend that. I mean, we can just train and meet him next Saturday if that's possible.
What do you think, guys? That's a good idea, Ryan. So I think it might be good if you discuss this in the WhatsApp. Like if you have the team of 4, see who's available, let's say tomorrow, Sunday. If 4 of you are available, maybe it's better to discuss within the 4 instead of waiting for the whole 16 fellows to come together, because I'm sure some might not have availability the same time. If you are all available on certain time, that might be good also. So what do you think? Am I mute or are you mute?
No, we are mute. I agree with you, Dr. Nader.
Me too. I think dividing us on the groups will be better and more convenient to each other.
Yeah, I think that's also a good idea, Dr. Nadir's idea. And also, I think we are in different time zone, so I think it will be easier, like to split into different groups and based on our work schedule and all that.
Yeah, maybe
So,
if we can put our availability in the WhatsApp group and like the best times for us, whoever free at that time, maybe can just call or text immediately, and then we can, like any 2 people available, they can start to practice instead of wasting time waiting for someone or something like that.
Okay, perfect.
Like,
Thank
yeah, I
you.
think if okay.
and I think you can create. I mean, you can host a Zoom meeting for you guys who is available, and at least 2 you can start. But if more join that, they can be as observers, and then they can give feedback. Or if there are more than 4, then or they can create their own session, and then they can practice, and then they can convene all together at the end of the practice, maybe. So I'm thinking is the sooner you practice, the more time you have to practice, and you will be ready if instead of waiting another week and then another week. And,
Yes, I think I will be in charge of the next week. I will start to schedule maybe a Zoom meeting for whomever available or as many people as could attend at that time, and 2 volunteers. They can start to do like the whole interview from A to Z, and we get feedback from all other participants, and we can take it from there. Maybe every week someone in charge to schedule and at least to have 2 volunteers and prepare the questions and all these things.
I agree, but my suggestion is, even if there are people who are available tomorrow, Monday, during the weekdays until next this coming Saturday, then maybe they can start practicing. We don't have to wait another 7 days to. But if everyone is busy and there is no way to get together, then the weekend, yeah, I agree with you, Khalid. Maybe we can wait. That's, I don't know, every one of you has many things to juggle around and busy, but just a suggestion.
Yeah, I think Dr. Nadir's suggestion is great. We can WhatsApp to each other and during any time, and then we can see if like at least 2 people at the, I mean, that's the minimum, or like even 3-4 people are available. We can just practice, and even possible we can record that and put it in the app so the other people can hear it and like, you know, get feedback from our like conversation.
Sure.
And so by that way nobody will miss anything if they feel, and like whoever is available, we can keep practicing until next Saturday. That's a good idea, because at any moment at this time we might get interview, or like, you know, we might I mean, I think the sooner is better. That's the whole point.
Sure. Yeah. I agree with you. Yeah.
Yeah, sounds perfect.
And one more thing, in the meantime, as Ryan mentioned, try every one of you to seek the help. What department you said, Ryan? The one with human resources, that they can also offer some tips or practicing interview skills with them.
Yeah,
Yeah, go ahead.
yeah, it's a Department of Labor.
So if every one of you in the US, they can access their State Department of Labor website and seek some help and set up an interview skill session with one of the guys or some people from the department, that might also give you a chance to practice and maybe seek some input or feedback from them. It's available. Why not? We all, I think, work and pay taxes. So why don't we get use of the available resources around us? Okay. Any other addition? Thank you so much, all of you. Anything else you want to share? All right. So I just want to remind you again, if you have any material that you want to share, please use the, you can use a WhatsApp. If you use a app, that would be great to add some of the materials so that other people can look at it and benefit from it down the road. But thank you, all of you. Once again, thanks for the great tips. Thanks for sharing, and I wish you all the best. Good luck with your interviews, and good luck with the residency, inshallah.
Thank
Thank you so much.
Thank you so
Thank you.
much.
Have a great day, everyone. Bye-bye.
You as
Thank
well.
you.
Bye. Thank you.
Thank you for your time.
You're welcome.
Thank
Thanks.
you.
You're welcome. Thank you. Bye.